The state of Florida has 1,800 miles of coastline and over 11,000 miles of river, streams, and waterways. Northern transplant David Rose is taking full advantage of the Florida lifestyle.
I'm originally from Ohio. I spent most of my life in Connecticut and moved to Florida about 23 years ago. I work for Regions Bank, which is a regional bank. I'm a financial advisor there, so my job is really to work with people, trying to help them secure their financial futures. And I love anything to do with the water. I do a lot of boating, tennis. I love anything outdoor. I have a dog, which you'll probably meet later on, and we like to walk. And I guess basically I moved to Florida to be outside.
He remained faithful to his outdoor activities until a sudden pain interrupted his routine.
Well, my pain started about 2.5 years ago. It was an all of a sudden thing. I'd never had any pain because I used to rollerblade. As the pain kept getting worse and worse, like probably most people who don't like to go see doctors, I kept putting it off and off and off, thinking that, well, it'll go away eventually. It got to a point where I really couldn't get out of bed. It got really bad. Pain was really, it was crippling. Because I live alone, it was a major concern because I really wasn't sure if I could even go to work some mornings.
Stemming from the lower back, David's pain traveled to his lower extremities.
The pain that I had really was pretty much in one leg, only through my hip region. And it was like, it started off as I would call it like a prickling pain. It would be like a stinging at first, and then all of a sudden it became far more intense. It was hard to deal with, it really was. It was hard to get rid of. I used to take aspirins and different things, but it really didn't help that much. It was always there, day, night, all the time. So, and it became worse with time, which that was when I realized I had to do something about it, whatever that was going to take.
Ready to find a solution, he sought help from over-the-counter medications. When they didn't help, he turned to a local clinic for a solution.
Because I was trying to find answers for the pain, I chose several different avenues. Started with taking just normal painkillers and things of that nature, thinking that I'd be able to cope with it. Unfortunately, that didn't work, so I started going to a sports medicine clinic here in the Fort Myers area. Very nice people, and their prescription was certainly having physical therapy, which certainly worked, it helped. They were also giving me these shots. They were $1,000 a piece, but they said, this will work about a month and then we'll see you again. Well, the first one worked about 3 weeks. I saw them again. The second one worked about 2 weeks, and I said, no more $1,000 shots. This isn't making any sense. And that's when I started looking for other help.
David began researching his options online, where he discovered the Bonati Institute.
Realizing that I needed some help that was going to be long-term, not short-term, like most people, I went on the internet. There were several laser institutes, and I'd seen different commercials on television as well. I did my research on the internet, and I found two that I liked, and the one that I liked the most was Bonati. And I liked them because they seemed like they really cared about people. The commercials, the ads, and I guess we're all susceptible to those types of things, but I felt that it might be a place that I should at least check into. And so my first step really was to call, number one, and find out more about them. And I was very impressed with the way people got back to me almost every day saying, this is where we are, we've reviewed your MRI, and the total attention to my needs was pretty evident from the very beginning. So, I mean, I felt very comfortable. They described what they saw as my problem, which I kind of knew already, but certainly they clarified it. You know, shortly thereafter I realized that, they knew what the problem was, and they told me exactly what they would be able to do as far as helping me. It was a matter of, taking the next step, the next lunge forward and having it done. I was willing to do it because of the confidence level that I built with them at the time.
For patients like David, with more than one area of issue, procedures are performed one level at a time. This ensures both stress on the body and recovery time are significantly reduced, and a patient can leave the institute shortly after surgery feeling their positive results.
When I went up to the Institute, my physician asked me about the pains and so forth, and he reviewed my MRI, and he said that from what he could diagnose, it was basically calcium buildup in my lower area back here, my L1, L2, L3, L4, all the way up. He said that it would take actually 3 separate treatments. So the first day, they were going to just work on the L1, L2, And then I was supposed to come back the following week after I had that done. What's nice is they really told me exactly how I would feel when it was over. I mean, and very explicitly. And they were very accurate. I mean, I felt no pain. This was in the front of my leg, which was the L1, L2 apparently. But they said because of the additional pressure on the rest of my leg, I would feel that even greater than before. But when all three treatments were over, it was phenomenal. But it was really quite relieving to have that pain gone for the first time in 2.5, 3 years, that I could actually sleep at night, get up in the morning and, become a human being again.
By using conscious IV sedation, the Bonati spine procedures can make certain the true cause of the pain is eliminated, and the patient remains a participant throughout his recovery process. Though sometimes patients have been known to say things they don't remember.
Before I had the operation done, they explained to me in detail what the procedure would be, which was very helpful, so there was really no surprises. And they told me they needed to keep me awake and watch the monitor in order that I could give them feedback as far as how I was feeling at the time, and they also wanted to know exactly where they were going in addition to seeing it, but they wanted to know how I was feeling it. But the funniest part was at the very end when I came out of the surgery. They allowed me 20, 30 minutes, whatever it was, to recuperate. And everybody in the room was laughing. And I said, okay, so what did I do? Am I the scapegoat here? And they said, David, you're the funniest person that's ever been here. And I said, what do you mean? They said, well, you've been telling jokes for 2 hours. And I didn't know that I knew 2 hours worth of jokes. So it was a funny experience. And, again, it kind of built on the camaraderie and the friendship. And so when they said, you have to come back next week, I was kind of looking forward to it.
David is now living pain-free again and getting back to his active routine, especially with his faithful companion, Mia. And he tells those searching for relief to keep their mind open and look at all possible options.
After I left the third operation, when I returned home, there was virtually no pain at all as far as what I had experienced before. The sciatica, or whatever they call it, it was pretty much gone. But there's still a learning process. I'm still retraining my leg to walk, and sometimes I feel like I walk with a limp, but it's not because of the pain, it's not because of the operation, it's because I haven't used the leg for 2 years, basically. On a success level of 0 to 10, it was certainly a 10 because the problems that I had when I went up to Bonati was totally gone. So it was a wonderful feeling to not have to deal with that again. When I meet people who are in pain, if they tell me, or if in our conversation they indicate that they think they have to have surgery of some sort, I always recommend that before they do it, they should get the advice of other people. I've told a number of people already about the Bonati Institute, and I'm saying I don't know if it's the answer for you because I'm not sure what your problems are, obviously, but certainly you can speak with a professional. Before you do anything with a knife or any kind of surgical procedure, I'd say seek other opportunities, and Bonati might be one of them for you.